I want to ask Carrie about the rollout of vaccines here because it's so. Look, I think it's fair to say it's very disappointing. People were very excited about the quick development and the quick development and manufacturing of these vaccines, but the rollout that we've seen has been really disappointing to a lot of people. Just yesterday, we learned from Governor Cuomo that frontline workers here in New York will lose their place in line if they skip a shot. More than 30% of healthcare workers have resisted jabs, causing a surplus in vaccines. And here in New York, older people and first responders remain ineligible for vaccine. What is the right way to approach distribution here?
So I think it's important to remember that vaccine distribution is a state by state situation, right? So the CDC makes recommendations, but the states have to receive the vaccine and roll it out. There are known problems in some of the systems that are sending the vaccine from the federal stockpiles to the different states. But then once it reaches the states, remembering that we are right now vaccinating healthcare workers predominantly, we have to remember that, again, those systems are stressed. So we're talking about people who have been overworked, and now we're saying, okay, we also need you to administer vaccine to your folks to keep them safe. Hospital systems are doing it. They're working as best they can. There's also a lot of IT situations that are having to be resolved, right? So we have people that need to get the vaccine, but that person has to be entered into a system. They have to be tracked for a second dose. So it's very complicated, and it is state by state, but I think we should take a little bit of heart in this. First of all, these kinks in the system, they are getting sorted out. Second of all, the public health infrastructures are now starting to divert their precious resources, which they need more of, in order to start preparing to set up these vaccination clinics and pop-up areas so that they can bring the vaccine out into the communities when we start vaccinating individuals who are older. Some states have already done it, and they've done a great job, and a lot of their public health systems are working in that manner. So I think it's really a mixed bag. Overall, yes, the overall numbers show that things are not going as planned, but we do have shining examples of really good rollouts where communities are getting protected, and we need a way to share those best practices.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.